Hello, I'm Dr. Dennis McKenna. I'm joined today by John DePaula. JD, great to see you.
Good to be here, Dennis.
All right. Today's Thursday, May 5th, giving you the update from Albany Med. All right, John, we always start with COVID.
Yes,
we
sir.
have for the last 2 years. Let's start there. Pop open the first chart. Here's people in the hospitals in New York State currently with COVID. We see that number is 2,119. All right, let's pop open the next graph here. Capital region, that number's coming up. We're at 175. There was some dialogue today, emails back and forth, regional hospitals talking about their numbers, taking a close eye at that, watching that very closely. Next graph here, admissions and discharges, specifically on the Albany Medical Center campus. You can see, John, we have about 5 to 10 admissions per day, and admissions are currently outpacing discharges. So as a result of that, if we look at the next graph here, we can see our morning census is going up. People in the hospital here at Albany Med diagnosed with COVID is 54. That breakdown is 44 on the floor, 10 in the ICU, and as of this morning, I think we reported this at the safety brief, none on ventilators. That can change.
Okay.
That can change, but that gives you some idea where we're at compared to how we've been in the past. Last 7 days, John, for people admitted to Albany Med, we often talk about this as well. Last 7 days, we've had about 50 come in. So that's about 7 per day. 56 of those who have come in have been unvaccinated. So it is still over a majority of the people who come into the hospital either with COVID or because of COVID are unvaccinated. We are very close to a milestone. In the capital region, very close to getting over 1 million people vaccinated. We're inching up there.
Yeah.
We're at 971,000. So when we get to 1 million, we'll talk about that here as well. And then let's pop open one more graph. These are the variants that we are seeing. Omicron continues to be the dominant strain. As we know, we see breakthrough cases with Omicron, even with the fully vaccinated. Those breakthrough cases often are on the milder side and don't always necessarily, of course, result in admission to the hospital. In fact, that's pretty rare when it does. There's about 4 different subvariants of Omicron, and you can see them identified there. So we'll watch that very carefully as well. All right, let's move to some other topics, John.
Yeah.
Last week was a very special day for the medical college, and it occurred up at Saratoga. What was it?
Yeah, it was our commencement exercise for all of the graduating class. And really, Dennis, it's a holiday in many aspects for the staff, for the leadership of the college, and obviously for the students that have worked so hard to graduate and their families. It's a wonderful, wonderful day and event.
It was a remarkable event, John. It was our 184th graduation, which is fantastic. I graduated 30 years ago, walked across that same stage. The event really hasn't changed much in 30 years. It's still a fabulous event. And importantly, it's the first time in 3 years that we've had in-person graduation. And as you know, we invited back people who graduated the last 2 years who were unable to do in-person graduation. Some of them walked the stage as well.
And give them a chance to enjoy the day and the festivities, really.
Yeah.
Wonderful.
So congratulations to all of our graduates, and congratulations to all of you in the college who do the education of our medical students, our physician assistants, our nurse anesthetists, our medical ethicists, and our scientists. Really a remarkable group.
Great stuff, Dennis.
All right, John, the iCare Award was recently given out at our most recent Center Combined Leadership meeting, and it was an occupational therapist, and her name is Melissa O'Keefe. She came down. Wonderful. It's really lovely to give her the award. What did we say about Melissa?
Yeah, a colleague wrote about Melissa, always with a smile on her face. Melissa has consistently demonstrated compassion and patience during what we all know is a challenging time in healthcare. During the pandemic, Melissa started a new initiative to provide patients with personal care items such as toothbrushes, toothpaste, combs, soap, and lip balm. In addition, Melissa also became a lead for PAPR training in her department, as well as a lead for the splint team. She educated junior staff on proper splinting techniques and documentation. Her co-workers describe her as outgoing, professional, approachable, and always prepared. So, Melissa, we congratulate you.
She definitely embodies care. So compassion, accountability, respect, engagement. And it was wonderful to give her the award and represent the very important work of our occupational therapists in the hospital. Now, John, what is a care ambassador? So obviously, Melissa will now be a care ambassador, but what is a care ambassador?
Again, Dennis, a care ambassador is somebody that gets called out by one of their colleagues here at the medical center for always delivering unparalleled customer service. And you know, customer service not always is just for our patients. Right. As you just mentioned, it's for our students as well as staff members. Right. I really like when staff members take the approach that other staff members here at the medical center are also our customers. And we celebrated 22 individuals who were nominated by their colleagues to promote them as care ambassadors.
So every month we have somebody who is recognized as winning the Eye Care Award. But on top of that, if people want to nominate someone to be a care ambassador, there's a committee, they look at that, and if they're recognized, as we did at the most recent safety brief, we recognize them and we put them on the list of care ambassadors. So their names are on the intranet. I think there's a picture with all of them. They should be very proud of that and share that with their friends and family. Is that right? Where can we find that list?
Yeah, it's on the AMC intranet landing page. All those individuals are named. And again, Dennis, to your point, we talked about morale a couple of weeks ago, and these are the kind of people, these 22 individuals, that really help drive the positive morale that we have going on here at the medical center.
And you out there, you might be a care ambassador, and or you might want to nominate a coworker. I think that would be wonderful to recognize what it means to work alongside someone that you respect so much. So speaking of respect, we obviously love and respect our nurses here, and a very special week is beginning. It happens every year. It's Nurses Week, and I have to get reminded about this every year. It starts on a different day every year because it always has to end on May 12th. Now, John, you probably know this. Why does Nurses Week end on May 12th?
To be perfectly honest with you, Dennis, I didn't know this until you helped educate me.
Yes, go ahead. What is the reason?
It's Florence Nightingale's birthday. It's a celebration of her birthday on that May 12th day.
May 12th is an important day. Florence Nightingale, very important in the history of nursing, of course. And so it'll start tomorrow, May 6th. And there's a whole list of activities for the next week.
Whole host of celebrations, everything from ice cream, merch. I think we're buying the nurses lunch one of the days. But the day that really, that I feel is very, very special, it's when we have our Pillars Nursing Award. That celebration is on Wednesday at 4 o'clock, next Wednesday at 4 o'clock. We honor our nurses, typically 4, 5, or 6 of them that have been recognized by their peers of doing incredible nursing work over the past year.
We look forward to all the different events. If you want to know about what the activities are or what's on the schedule, just check with your nurse manager, and I'm sure they'll give you an update on that. John, in the area of nursing, there's also an exciting announcement that we can make here. We know, obviously, we're always looking to attract and bring into our workforce the best nurses out there. Nurses graduating from nursing schools in this region often find Albany Medical Centers their first job. And we have some great successes to talk about.
We really do, Dennis. A team of our nursing leaders and our human resource leaders have been really working on a weekly basis to recruit new grad nurses. And I'm happy to report that we've tracked 275 new grad nurses that have committed to come working here at Albany Med. And it really is. And
when would they start?
So it's a variety. So it depends on when they graduate from school. So some of the schools graduate sort of more middle of May. Some nursing schools graduate end of May. So it really depends on when they graduate. And then they'll start an orientation process here at the medical center. Typically lasts 3 or 4 months to make sure they're really well prepared to kind of go on their own and treat patients here at the medical center. So we're really, really excited about that. And we actually had a celebration for the 100 nurses that we do capstone clinical training here at the medical center. We had a couple of events last week to sort of celebrate them and congratulate them for graduating.
And they were from the nursing schools of Hudson Valley, Maria, and Sage, if I'm not mistaken.
That's correct. And Siena as well.
And Siena as well. Outstanding. So we congratulate everybody who's working hard to bring new nurses into the organization. We look forward to those 275 or more joining us this summer. So John, I'm wearing this t-shirt. Today and tomorrow is part of our annual radiothon for the Bernard and Millie Duker Children's Hospital here at Albany Medical Center. I was very fortunate to get on the radio today with 99.5 The River and 810 and 103.1 WGY, and I spoke to their on-air personalities about the medical center. So easy for me to do that because I love our mission, and it's so easy to talk about our workforce here. Just a couple numbers to share with you. This radiothon has been going on since 1998, And the very generous people of the Capital Region have helped us raise $6.8 million. All that money goes to support programming here on this campus. And when you think about the Children's Hospital, there's so many areas that we could focus in on. But the most important thing is that when we provide care to children in this region, number one, it's world-class care. Number two, it's care that can be delivered at home. They don't have to travel to New York City. They don't have to travel to Boston. They don't have to travel to Philadelphia. And that's not only good for their medical health, it's good for their families as well. We talked about some of the special programming we have here, our neonatal intensive care unit, right? We have over 800 babies a year right here on this campus, the lowest birth weight, the most vulnerable babies cared for in special private rooms. Our pediatric ICU, which cares for the sickest children and adolescents in the entire region. We have over 1,000 of those a year. We talk about our Melody Center, which treats children with blood disorders and cancer. 1,300 visits a year by patients. And then, of course, we have our Masry Family Emergency Care Center. We have so many areas. All of that is done by the work of 150 physicians who specialize in the care of children and over 500 nurses, child life specialists, therapists, social workers, all specifically trained to care for children. It's amazing, right? And it's right here. It only can take place at Albany Med. So we want to thank iHeartMedia, and we'd love to thank the region for helping us with this radiothon. And it's going to go on again tomorrow, too. So if you see people wearing the blue T-shirt, they're down there, they're volunteering, and we thank our workforce for that as well.
Definitely.
Very good.
Definitely.
Yeah, very good. Anything else going on, John?
No, I think we covered a lot again today, Dennis.
We did. And you were saying on the way over, it's beautiful outside.
Gorgeous day.
Yeah, hopefully it'll be that way this weekend.
Yeah.
It's Mother's Day weekend.
Mother's Day.
We'd certainly
We
like to.
love Mother's Day.
We sure do. And we'd like to obviously wish a happy Mother's Day to everybody out there listening who will be celebrating that. All right, we'll be back again next week. See you then.
Sounds good.
All right, very good. Some special announcements here on campus Monday. We look forward to making those as well. We ask that you once again please take care of yourself, take care of each other, and we'll see you next week.